prepare for us today independent work of students, history of national medicine. Okay, please listen now after I'm giving questions for all students. Okay, start.
Hello friends, hope you are well. Today I will present the PPT about history of national medicine in Kazakhstan. So we will cover the healthcare system in Kazakhstan, the facilities, the quality care in Kazakhstan, and national medical holding. Second slide, third slide, I think it is. So introduction. The collapse of the Soviet Union marked the formation of Kazakhstan and the development of its own industries, including healthcare, with Kazakhstan achieving stability and economic growth. A full-scale reform in the medical industry was announced between 1989 to 2001. The ratio of doctors per 10,000 inhabitants fell by 15% to 34.6%, and the ratio of hospitals beds per 10,000 inhabitants fell by 46% to 74. By 2005, those indicators has recovered somewhat to 55 to 75 respectively. In 2002, Kazakhstan conducted the first mass survey of the population. Its results showed that in the short term, special attention should be paid to the health care of women and children. Kazakhstan became the first country in the CIS where the vaccination of the newborn children of hepatitis vaccination was introduced. The prevention of cardiovascular and oncological diseases has also become an important task. So history of Kazakhstan pharmacy. So if you want to know about history of Kazakhstan national medicine, you should know about the history of Kazakhstan pharmacy. The reform also affected the system of providing the population with pharmaceuticals. The pharmaceutical industry needed not only condition to increase the production of medicines and saturate the domestic market, but also high quality effective regulation. Today, the pharmaceutical industry of Kazakhstan is developing at a dynamic pace and plays an important role in the country's economy. According to available statistics, over the past 10 years, this industry has been growing at an average of 12% per year, and it has been going from almost 20 years. This was facilitated by a number of factors: a low production base in an unsaturated domestic market, the arrival of foreign investors in this country also helped to grow this pharmaceutical business in this country, and long-term contracts under the state order, as well as the launch of EU common drug market. The origin of Kazakhstan pharmaceutical markets. So at the beginning of Kazakhstan, after independence, there was not much of pharmaceutical market in this country. There was, I think, only one pharmaceutical market in this country, but after that it grew up to 18 pharmaceutical markets. The origin of the formation of pharmacy organization in the country dated back to the 19th century. During this period, as a part of Russia in pre-revolutionary Kazakhstan, merchants were engaged in the procurement and sale of medicines brought from Russia. The need for medicine was so great that the country states repeatedly mentioned in their reports that there should be pharmacies at the hospitals. So the first pharmacy was established in the city of Ulas, and after that Palantis and Palantis cities. Thus, one pharmacy accounted for 248.8 thousand of the population. A quarter of a century later, the number of pharmacies raised to 80. Further progression. During a meeting at October, President Kasim Jomart Tokoy is noted that the medical and domestic situation in the country is changing in a positive direction. Since independence, the population of the republic has increased by 2 million people, and life expectancy has increased by 6 years. In his speech, the president noted that the infrastructures of medical organizations has been significantly increased. There are more hospitals in this country, 219 more hospitals and 1,200 primary health care organizations. And outpatient clinics have appeared. A unified national healthcare system was introduced, and the Republican medical centers, they began to carry out the most complex operations that were previously inaccessible to Kazakhstanis. So this is a brief summary about the medicine business. Today there are 96 domestic manufacturers of the medicines, medical devices, and medical equipment in this country. According to the Bureau of National Statistics of the Agency for Strategic Planning and Reforms of the Republic of Kazakhstan, the volume of the medicines and medical devices of domestic production for the period January to December 2021 amounted to 196.6 billion tenge. The total volume of the pharmaceutical market amounted to 820.2 billion tenge. As for whether local pharmaceutical manufacturers are able to fully cover the needs of Kazakhstan in Kazakhstanis medicine, despite the high growth dynamics of the pharmaceutical industry, domestic products still do not fully meet the need of the market. The volume of the pharmaceutical markets provide only 70 to 20% of the country's need for medicines. However, during 2015 to 2021, the volume of pharmaceutical production in the country increased by 2.5 times higher. In the volume terms, from $168 million in 2050 to $443 million in 2021. To ensure the availability in the provision of medical services to the population living in the remote villages, in the villages, transport medicine has been introduced and being developed. In 2020, 100 mobile medical complexes were purchased and on a basis to the existing ones. In 2021, 149, about 132,000 cases were detected. 149 mobile transport complexes were covered, about 1.8 million residents of 2,542 remote locations. About 132,000 cases were detected. So nowadays in Kazakhstan, the students who wants to do their undergraduate program, they are mostly interested in this healthcare program, and this paragraph shows us the statistics of their interest. In the healthcare provision, around 25,718 applicants want to serve in this sector. Of them, which general medicine was chosen by 12,218, which is around 47.5% of the total numbers of applicants, and the pediatrics was chosen by 4,259, which is 16.5% of the total applicants. Public health was chosen by 3,628, which is 14.1%, and last of all, and not the last of all, second last. Pharmacy was chosen by 2,716, which is 10.5% of the total applicants. And the last one is dentistry, which is chosen by 1,745, which is the total amount of 6.7% of the total applicants. In modern condition, and effective mechanism for innovative development is project management, which includes a structural component, resource provision, and a process component, technical provision, as well as the content of the result, which is characterized by the quality of public health and the quality of medical services provided to the population. The medicine of Kazakhstan undergoes a series of evolution. It has gone up to various steps, and nowadays it is very good, I can say. The healthcare system in Kazakhstan is magnificent and complex. During the formation of the medical system in Kazakhstan, there has been a major changes in the management, personal planning, and advanced training of medical staff. To implement this program, modern medical equipments, mobile patent delivery vehicles were purchased, and modern hospitals were built. The quality of the healthcare system nowadays in Kazakhstan has achieved the confidence to these citizens in public hospitals, and the reliability of public hospitals in Kazakhstan nowadays for citizens has been increased. So last conclusion. The transition to modern management methods has increased the indicators of social satisfaction with the healthcare system. For 30 years of independence, Kazakhstan has managed to build a successful healthcare system and provide quality medical care to the citizens of the country. Such a transition was possible to the creation of research institute and research and development in the country, which has provided market for healthcare services with high quality medical personnel. Due to the transition to compulsory medical insurance, the state managed to provide medical care to every citizen during the period of coronavirus infection. Stabilization by the healthcare mechanism has now made it possible to focus on cutting edge development and unresolved societal problems. Now in Kazakhstan, research is underway to combat diabetics and cancer. Such a transition was made possible thanks to well-established administrative and economic management methods. So there was a proper plan to do this properly. So at last I have to say that there is. I am not finished. So at last I have to say that there is no future without the history. So thank you for your attention.
EMON Ali, very beautiful PPT for your job. Okay, please sit. Now we are.